Ladies and gentlemen, dear colleagues, dear friends, it's my pleasure to address this 17th European Health Forum Gastein. My name is Marc Sprenger. I'm Director of the ECDC, the European Centre for Disease Prevention and Control in Stockholm. I really regret that I'm not able to attend this year's forum and I'm not able to, this morning, participate in person in your very important workshop to discuss the ongoing Ebola outbreak in West Africa. I would, however, like to contribute to the discussions by giving you an update of the situation in West Africa through this video message. I will also mention some of the actions that we, ECDC and the EU, are involved in. Since the start of the Ebola outbreak in December 2013, 4 West African countries have been affected, and the number of persons infected with the Ebola virus disease is steadily increasing in the region. According to the latest report from the WHO, there are more than 6,500 cases of Ebola virus disease, and of these, more than 3,000 people are reported to have died. And unfortunately, we believe that this is only the tip of the iceberg. We don't know what the figures are in reality. Recent modeling predictions made by various experts and organizations, such as CDC in Atlanta, predict many more cases to come, possibly even up to 500,000. At ECDC, we are monitoring the situation very closely and have activated our internal 24/7 public health event response system in order to ensure that we have enough capacity to respond to this outbreak. We are regularly producing epidemiological updates, risk assessments and guidance papers to assess the situation in West Africa and to assess what the risk may be for Europe. In addition, a number of our training fellows in epidemiology and microbiology, our APID and UFAM fellows, have been deployed to the affected countries in West Africa. Each fellow has been deployed, of course, under the WHO umbrella. And it's good to see how these fellows are able to put their extensive knowledge to good use. I'm really impressed. But it's also of great concern that an increasing number of healthcare workers in the field are being infected by the Ebola virus. Though the risk for transmission in Europe is extremely low, we may expect sporadic cases also in the EU, such as the one we have just heard about from our colleagues in the United States. The current outbreak in West Africa is unprecedented and will therefore require an unprecedented effort to bring under control. And as a doctor, it has been welcoming to see the reaction, and in particular the dedication and professionalism of the public health community. It's crucial for us to embrace a coordinated approach to this outbreak, both at the European and at the global level. Only then we can help to control this outbreak. Now, just over a week ago, the EU Ministers of Health met at the informal Health Council meeting in Milan and raised their concern over the current situation in the affected countries in West Africa. The ministers also discussed how the outbreak could affect the EU. Of course, ECDC is committed to support the European Commission, European Parliament, the Member States, with risk assessments and guidance. And we work in very close collaboration with WHO and CDC Atlanta and others. A strong coordinated approach will be central to overcome this outbreak. Now you as decision makers in public health and healthcare at the European Health Forum in Gastein, as a platform has a very important role to play in these discussions. Good public health systems need to be in place, as well as strong international coordination to overcome this outbreak. And my thoughts are with all the victims and their families of this terrible outbreak in West Africa. The question we need to ask ourselves is, how has this been able to get out of control? And here I would like to support the advocacy of Professor Ilona Kikbush regarding good health systems and good governance. At the same time, as a world community, we need to be facing the reality. And what is the reality? The reality is that an epidemic such as this one only gets out of control due to the weakest link in the chain. So for me, the most important question is, how could we translate our discussions, transform our discussions into substantial improvement for the weakest regions? I hope you will be able to address this question in the discussions this morning and see how you could make a difference. Thank you.